doing my presentation on Chapter 3 of the text, Patient-Caregiver Communication. My article will focus on the imbalances in power when it comes to patient-doctor communication. I'll start by discussing the imbalances that give doctors power over their patients. Doctors generally have more knowledge than the patient. This leads to most of the medical encounters between a patient and a doctor being physician-centered, which means that the doctors do most of the talking. They choose the conversation topics, and they start and end doctors' visits. Basically, the doctor. Another reason for this imbalance is something called therapeutic privilege, which allows doctors to withhold information if they think it would harm the patient. Personally, I don't think that this is right. Patients have the right to decide if they want to know all information that pertains to them, harmful or not. And patients rarely assert themselves in medical encounters. They allow doctors to talk down to them, raise their voices, patronize them, and/or avoid emotional topics they want to discuss. The information patients will be able to provide is being ignored and devalued. And this brings us to the why. Why does this imbalance of power? We don't have a choice. We think we have to do what the doctors say because they went to medical school, so they obviously should know what's best for us. That's not always the case, and we should speak up and say what's on our mind. Another reason is because of social expectations. We think we have to act a certain way during these encounters, so we do. Patients also allow the power imbalance because they want to stay in their doctor's good graces. They don't want to run the risk of being denied care or given subpar care. Both doctors and patients pay a substantial price for this imbalance. Patients do not receive optimal care and treatment because their knowledge is never used, and this causes them to feel detached from their illness and treatment process, and they are consequently unable to follow the treatment to be labeled non-compliant. Doctors, on the other hand, start to feel overwhelmed by the pressure and suffer from depression, substance abuse, and the highest suicide rate among all academic professions. The screenshot from the website Medscape shows that as many as 400 doctors commit suicide each year, which is enough to fill an entire medical school. To solve these problems, patients need to be given responsibility for their own bodies and illnesses and assert themselves in medical situations as human and recognize their limits and let patients have their say. Now, I have a video patient interaction should be.
The second technique would be the concept of using a dialogue, asking and responding, asking and responding. When we ask open-ended questions, we give the patient the opportunity to say simply much more than yes or no.
There are two separate techniques that we have used to improve patient understanding.
Do you understand what I'm saying?
The first one is to
patient
ask
will, of course,
open
say they
questions.
understand what we're
The
saying.
second technique would be the
In reality,
concept of
we need to
using
ask them,
a dialogue,
what did I tell you?
asking and responding.
We
Asking and
oftentimes need
responding.
to say, what will you tell
When we ask
your wife?
open-ended questions, we give the patient the opportunity
What are we
to
worried
say
about?
simply much
Are we
more
worried
than
about
yes or no.
By
We in
asking the
medicine will
patient
oftentimes
what
say,
they understand about the
do you
process,
understand what I'm saying?
will give us
The
a better
patient will of course
understanding
say they understand
how
what
we
we're
can help
saying.
the patient.
In reality,
Because we need
we need to
understand
ask them,
the patient.
what did I tell you? We
We will
oftentimes need to say, what will you tell your wife when you go home? What are we worried about? Are we worried about anything? Sometimes we need to provide the patient with small amounts of information, but we need to verify that the patient understands what we're trying to tell them. By doing the technique of asking and responding and telling, we're maintaining a
idea of how we can help.
most important tools assessing the patient's idea of how we can help them.
Okay, that's it for the video. And now I have two questions for you guys. The first question is, what other ways do you think doctors and patients could bridge the gap between caregiver and patient communication? And the second question is, personally feel about the imbalance of power between the doctor